everyone. It's great to have you back on our podcast, your go-to place for open and real talks about health, about wellness, and the little things that shape our everyday lives. As usual, I'm your host, Dr. Louisa, and on today's episode is all about the guys. It's about our fathers, our brothers, our husbands, and basically all the men in our lives. Because it's November, and as we all know, November is Men's Health Month, so it's time to raise awareness about the health challenges that men face. It's only right that we do that. And this is both physically and mentally. So we'll be diving into everything from mental health to diabetes to sexual wellness, including a topic that is usually swept under the rug, which is erectile dysfunction, or ED as it's sometimes simply called. So if you've ever had any questions about it or felt embarrassed and didn't know where to turn to, then this episode is for you. So we've got two incredible guests joining us today. First up, we'll be speaking with Dr. Tobo, a leading urologist who will walk us through what men need to know about their health, and he'll also break down erectile dysfunction from a medical perspective. And then we'll also be speaking to Fam Nanayao, who will walk us through some of the natural options that support men's health, including a product called ManUp. So stick in and stay tuned and make sure that you take notes because it's going to be a very interesting conversation. Thank you so much, gentlemen, for joining me today.
Thank you.
Yes. So, Dr. Tobo, first of all, I'll start with you. When it comes to men's health, there's this thing about men not reporting early to the hospital. Right. And the statistics show that on average, men are dying 5 years earlier than women. And when you even look at the statistics for things like a cardiovascular disease, suicide, it's always the men that are affected more. But then they also do not report early to the hospital. Why is that?
Thank you very much. I think this is a very, very insightful question.
Yeah.
First of all, when men are afflicted by whatever condition, and particularly when you try to relate it to a private situation like sexual health, because sexual health is so private, most men, feel embarrassed discussing it. And sometimes it is due to the way we are conditioned by the society.
Yeah.
Masculinity is related to your sexuality. So people think that if they have to discuss issues about their private, or sexual health, then they are giving themselves away. They are showing themselves to be less of a man. So they would rather keep it to themselves or not do anything about it at all. Sometimes, too, it is due to the fear that whatever they are suspecting will be confirmed by the doctor. They already know that there's something wrong. They don't want somebody to confirm that prophecy.
Right.
So they will rather keep themselves, in their closet than, come out. Then also some men lack the awareness. Some people think that the urologists say we just treat urinary tract infection, prostate diseases, etc. They are not aware that some of these things are within our purview for us to treat. So because of the lack of the awareness, and then some people also already start taking some things on their own over the counter. So it's a combination of all of these, factors. That's how come men tend to keep things on their own, and then they will only report when they are pushed to the wall.
Yeah.
Pushed to the wall, and then things are too late.
Well, that really resonates because we realize that there's a lot of pressure for men to appear strong.
Yeah.
And even in our culture, our local culture, some of the sayings like "Bemensu" and "Man up," you have to be a man, and things like that. It puts a lot of pressure on the men. And so, I totally agree with you. But then, when it comes to men's health, what are some of the most common conditions? You being a urologist, you've seen tons and tons of it. What are some of the common conditions that, are often overlooked from your perspective?
The interesting thing is that sexual dysfunction in itself will either come isolated or it comes with other conditions.
Right.
So you will have a man who will come to you from my unit with a prostate condition, with erectile dysfunction, and then going through the assessment, you realize that, hey, Diabetes is hiding out there. Hypertension is there.
Yeah.
Cholesterol problems.
Right.
Prostate problems. And prostate problems, either you have the benign enlargement, the inflamed prostate, what we call prostatitis.
Right.
Or worst case scenario, the cancers. And then some people may also have blood in their urine as a common condition. And mental issues. A lot of the times, like we pointed out, societal conditioning. So most men may have subtle mental issues without it being so overt. Somebody said it's not a person on the street with their dirty clothes or stripped who is the mad person. You can have a mad person wearing suit, So they come to us and you realize that they have really deep psychological issues. And of course, the sexual dysfunction as a big problem. Most people don't know that sexual dysfunction, or let me say erectile dysfunction, will really point to some of these chronic conditions.
Right.
So it is after the assessment that is when they get to know that, hey, that is what is afflicting them. So in general, that is what men can come up with.
Right. I'm glad that you mentioned erectile dysfunction. I actually didn't realize it was such a big deal until I made a post on social media talking about the link between poor oral health and then erectile dysfunction. And my inbox was blowing up. All types of people, friends calling, people sending messages. How true is this? What can I do to avoid it? And I was like, wow, this is really a hot topic.
Absolutely.
So I try to create some awareness. But since you're here today, I would love for you to explain the link between poor oral hygiene and erectile dysfunction. But we'll get into erectile dysfunction on its own.
Yeah.
And I'm glad that you mentioned the link between erectile dysfunction and so many other chronic conditions. I'll be glad if you just quickly touch on that, and then we'll get deeper into erectile dysfunction.
When you have poor oral hygiene, basically what you're having is the tissues within your mouth, particularly the gum, getting inflamed.
Right.
And once it is inflamed, the body tries to handle it by, producing substances which will try to deal with it. Unfortunately, it is not contained and it gets into your bloodstream, what we call cytokines.
Right.
And these can affect the inner lining of blood vessels, the endothelium. That's the name given to it. In fact, somebody coined, an interesting phrase that erectile dysfunction equates to endothelial dysfunction.
Right.
So the inner lining of the blood vessels becomes affected, and that is where the smooth muscle that needs to relax to receive blood into the blood vessels are. Those smooth muscles, once they become stiff, and those smooth muscles, once they don't produce, there's a chemical called nitric oxide, that the levels also go down. Then, in other words, the quality of your erection, once blood cannot rush in, becomes affected. So even though the problem is happening in your mouth, because of the release of some of these substances, anywhere that you have blood vessels with endothelium or the inner lining, they can also be affected. In other words, if you have some of these diagnosed mouth conditions and you seek the right professional care and you have the right treatment, studies have shown that whatever might have started with erectile dysfunction actually reverses.
Yes. Okay, Doc. So I think we can confidently say that ED is not just about the body. It's, a blend of, the physical and mental state of the person. So I would like us to get a bit into that as well, that combination.
Right. So before we get to erectile dysfunction, let's look at what pertains normally.
Right.
Before somebody will get a strong erection, which will give the partner satisfaction, you need a stimulant. The stimulant is what gives you the arousal. So the stimulant works on the brain. In fact, the brain is regarded as a primary sex organ. Once you have things stimulated in the brain, then there is arousal. And that is where the organ, or the penis for that matter, blood rushes into it because of the release of certain transmitters along the nerve, pathway we call nitric oxide.
Right.
Now, basically what they do at the blood vessels is to cause the blood vessels to relax. I don't want to go into the technical details.
Right.
Blood vessels to relax, to receive more blood. And as the stimulation continues, and there are various stimuli, we have what you see. So when you see your partner's nakedness, or you remember certain erotic scenes, or tactile when you touch, or sometimes smell. So that is what the what we call it, the perfume industry try to utilize by producing, perfumes which are so sensual.
Wow.
Or sometimes you reliving past erotic events.
Right.
I do that a lot.
Okay.
If I want to, turn myself on, it's always good. Your memories are always very, very good. Those things are very powerful stimulants. And as you continue, it is said that there's a local nerve, center around the genital area. They continue to stimulate the organ and make it more and more turgid. This is very important because when you come to the definition of erectile dysfunction, it is either inability to achieve and or maintain. So some people can achieve, but they may not be able to maintain. So that's why we advise, partners to take time and then engage in foreplay. Some of these things cause the sustenance of the erection instead of the man trying to quickly go in and then come out. So generally, there's an interplay between the nerves, the blood vessels, the psychology. In other words, if you have somebody whose psychology is affected, then it affects the stimulation, it affects the arousal. And if the nerves are also disturbed, then you may not have the transmission of that stimulus from the brain. If the blood vessels are affected and there are conditions which can affect that, then you may not have the blood vessels relaxing to receive, blood to make the penis turgid. If relating to the blood vessels again, the nerves, the veins, it has been realized that with age, some of the veins are not able to trap the blood vessels in. So quickly the blood will leak. And that's when they are not able to achieve sustain it. If your hormone levels, drop, it has been found that as you age, your testosterone level drops. In fact, it is said that for every decade after 30, the testosterone level will drop by 10%.
Wow.
But what I always say, you see, it is better to drop with a parachute than to drop like a stone.
Right.
Yeah, so if it is dropping, it should drop gradually, steadily. In that case, you have things that can maintain it for you not to have an overt problem. So generally, you have this normal sexual cycle, and there may be issues related to the mind, so your psychology, with the nerves. Diseases can affect like diabetes, like spinal cord injury. With the blood vessels, diabetes coming again, hypertension comes in. In fact, with hypertension, it has been found that by the time you're diagnosed, the hypertension would have caused enough damage to your endothelium for more than 5 years.
Wow.
High cholesterol can also be a problem. And smoking, either active or passive, can affect your blood vessels. As for the hormones, like I said, with aging, it can drop, but there are certain medications too which can affect your hormone levels. Some drugs that are used to treat prostate diseases, and then some tranquilizers, antidepressants, etc. And then stress. Stress can invert. It is said that once you are stressed up, your testicles just shut off.
Wow.
Yes. So there are some people, when they come, we give them medications, all right. But when they go on a holiday to distress, they realize that they don't need they only have to take the medications after all. So stress is a very, very bad performance killer. And then performance anxiety, what we call the self-fulfilling prophecy. You have gone in to do it, and then you fail. Now you're afraid to go back to do it because you're afraid to fail. And if you have a partner who always comments on your failures, it worsens it.
So the ladies, they also have a role to play, isn't it?
That's it.
Okay.
That's it. So in a nutshell, that's it.
Wow, this is very insightful. A lot of these things people don't realize, especially the stress factor that you mentioned, because stress is not something you can see. It's not even something you can actually detect until someone tells you that you look stressed, or you yourself do you review yourself and realize that you're stressed. So this is very important to note. And what you mentioned that after 30. Every decade after 30, there's a 10% drop in testosterone
Absolutely.
levels. And I'm sure this is something that most men who are growing don't want to hear, because every man wants to, stay youthful, throughout their days until they die. So how then are they able to balance this out? As nature is already taking its course and their testosterone levels are dropping, how are they able to balance it out so that the effect is not so overt?
Yeah. That's a good one. Somebody sang a song said, "Forever young. I want to live forever young."
Yeah.
But the reality is that as you grow older, every age you add to your number reflects on your body being weakened in various aspects. But like I said, you can slow down the rate of decline. You can slow it down by very simple, initiatives. Lifestyle modification.
Right.
Basic lifestyle modification. So exercises. Unfortunately, we don't exercise, well enough.
That's true.
We don't exercise well enough. And there are general aerobic exercises and there are specific exercises related to the genitals.
Oh, wow. I don't think a lot of people knew that.
Oh, they are simple ones.
Really?
Kegel's exercise, for instance.
Okay.
Kegel's is prescribed mainly when women after childbirth.
Yes.
And then men after prostate surgery, particularly radical prostate surgery, leak urine.
Okay.
It helps to strengthen those pelvic floor muscles.
Right.
And then also we prescribe it for those who have premature ejaculation. And it has been found to be very helpful. In fact, I've had patients who you prescribe medications, they start these exercises and then they go off the medications.
Wow.
Yes. So Kegels is a very, very important exercise, both for the down there.
Okay.
Yes. Yeah, it helps a lot. And then the general aerobics, at least 2 to 3 times in a week, 15 to 30 minutes, something that will help you to sweat.
Right.
It's very, very important. Then obesity, keeping your weight. If you will not lose weight, just keep it static, keep it controlled. Keep it controlled so that you see, the thing about weight loss, for you, it gives you a sense of well-being.
Yes.
When you know you've not increased weight.
Yes.
And then also, sometimes when you put on unusual weight, at the back of your mind, you're thinking, hey, am I looking unattractive? It's my partner finding me, especially when they pass a comment.
Right.
And it is usually a disincentive when your beloved passes a comment on your weight. So sometimes we always advise them to find a very nice way of commenting on that or helping you out. So weight loss is very, very important. Smoking. Somebody may say that, hey, I don't actively smoke, but look at the environment. You get to environments where people smoke. So passive smoking, you inhale it. It can affect those blood vessels.
Right.
Smoking goes with alcohol. It is said that alcohol can turn you on, but in a long term, especially if you're a chronic drinker, it can affect those nerves.
We're going to talk about that a lot because that is also another misconception. I don't know. You'd have to tell us that, alcohol is one of the stimulants that most of the young men go for, and especially with these herbal preparations and all that. So we'll come to that.
Sure. Absolutely. So when it comes to alcohol, well, you'll be advised about moderation and all that, but it heightens your expectations. But when you go to perform, you realize that you may not be able to go the full mile.
Oh, wow.
Yeah, may not be able to, especially if you've taken it chronically. It damages the nerves.
Okay.
Essentially, and then the inner lining of the blood vessels also. We touched on stress.
Yes.
Yeah. Once again, stress is a very, very powerful sex, killer. Stress comes in different forms: physical stress, emotional stress. So physical stress, there are people for a very long time who have not gone on leave. So we always advise people, at least, thankfully I'm on leave now.
Oh, great.
We advise people at least take some time off.
Take some time off,
For the system to reset.
Yeah, very important.
Yes. So, and another aspect of physical stress is inadequate sleep time. Those who don't sleep chronically, those who sleep chronically less than 6 hours at night, like I said, the testicles just shut off.
Wow.
And one of the earliest indications is when you are not getting those early morning erections or those spontaneous. Sometimes you are there and then there is a spontaneous erection. It is so gratifying. But when those things are no longer there, early morning erections are no longer there, you should look at your stress levels. And the thing that stress does, you see, stress triggers that part of your nerve system which is akin to you jumping a wall when a lion appears here.
Right.
What we call the sympathetic system.
Right.
And there are people whose nerve functions are always heightened like that. So their adrenaline levels are always very high. So, in other words, you should put in things or interventions that will keep that adrenaline rush always down. So adequate sleep, adequate ways of distressing, mind therapies, listening to good music, avoiding unnecessary distractions, supporting the right team. Yesterday my team won.
So there are some football clubs that are causing a lot of these problems. Wow, guys! So choose your team correctly, isn't it?
Yeah.
Wow.
I was happy when Harry Maguire scored yesterday. No, but the thing about a team also is that, you see, if you support the same team which is losing perpetually, it also shows how loyal you are. And how strong you are emotionally.
You're right. It's building you up.
Absolutely. But you shouldn't stress yourself too much. Yeah. So the stress, that physical stress has to be dealt with. Then emotional stress, particularly when it comes to a beloved. Somebody said that somebody can give you emotional stress from outside. It's not like the one in your beloved giving you a lot of stress that can turn you, that can turn you off. And once again, the performance anxiety, people commenting on your past failures. And one of the worst things is when they comment on the size of your organ. That can actually be a turn off.
Wow.
So in general, these are some of the things that we can work against so that we can, and then there are some supplementations and medications that can come in to keep everything well balanced. And then a very good diet. Diets of fruits, vegetables, very good balanced diet with enough water.
That's great. Wow, Doc, thank you so much for this insight. So, there's so much that we are supposed to do on our own to be able to maintain, sexual health. And when I say we, myself excluded, I'm talking about the men because today is all about you. So thank you so much, Doc, for all of this insight. So, Doc, you mentioned Kegel exercises, and I'm sure for most of the men, this is like Greek to them. They've never heard about Kegel exercises. So if you could briefly tell us what these Kegel exercises are and how to do them, I'm sure a lot of people will be glad to hear about that.
Right. Basically, the Kegels exercise, like I said, is mostly prescribed for patients who have involuntary loss of urine, what we call urinary incontinence, and sometimes for those who have premature ejaculation. But commonly, it is the women who are prescribed that form of exercise, especially after childbirth,
Yeah.
so that their pelvic floor muscles could tighten up.
Yeah.
That has been found to be very helpful when it comes to erectile dysfunction, particularly the premature ejaculation and erectile function as a whole. Basically, the Kegels exercise is a 3-in-1 exercise. What most people know is you trying to hold urine midstream. So you're going to urinate and then you try and then hold the urine midstream. Now, after doing that severally, you try to imprint that in your mind as if you were holding urine midstream. But there are two others where you are releasing gas from your back passage, from the anus, and then you stop the gas from coming out.
That's also Kegel exercise.
That's part of it.
Okay.
You're releasing gas from the anus and then you stop it. You try to hold it instead of releasing it.
Oh, wow.
Then the third one is trying to imagine or trying to contract your penis inward. Now, that is a very subtle and very, very slow or short movement, trying to move your penis inward. So basically, there are three: contracting your penis or moving the penis inwards, trying to stop urine midstream, and trying to stop gas from the anus from coming out. Now, if you can combine these three at once, it doesn't come easy, but once you practice it regularly,
Right.
you'll be able to get used to it, and you do it, for 10 to 15 seconds severally every day, and you'll be fine. Thankfully, there are a lot of short videos on this
Yeah.
on the net, and it shouldn't be difficult at all. It's been found to be very, very helpful for men who would want to, achieve very strong erections and move away from medications. Because what I always tell my patients is, and they always ask, Doc, am I going to be on these drugs for how long? So some of these interventions, together with the lifestyle modifications, can take them away from, established medications.
Right. That's very insightful. So, Doc has shown us the 3-in-1 method for these Kegel exercises, but you can also go on YouTube. Now we have social media, we have YouTube, so you can go on there and learn how to perform these Kegel exercises for yourself. So, Doc, let's come back to the topic of alcohol use as a stimulant for sexual performance, and also herbal preparations, because that is something that is very common now on social media. It's all over. People are selling all sorts of concoctions, and sometimes I wonder, how are you able to measure the correct dose of whatever is going in there? You don't even know how much of what is in there. How safe are these products, and do they actually work?
Yes, so social media, like you rightly pointed out, is bustling with a lot of so-called supplements, which promises so much but under-deliver. Yeah, and unfortunately, there's bad or poor regulation when it comes to these products, except, of course, when it gets to a jurisdiction, then the relevant agencies like the Food and Drugs, authority can help to curb, some of these. But we always make the point to our clients or to the general public that, hey, you should go to relevant places and get relevant prescriptions.
Right.
Drugs which are already established. So you shouldn't see something on the net and then without verifying, you will just decide to, go for them. And more so, these medications are not without their side effects, particularly when they are laced with the alcoholic, beverages. Most of the times, and the people who take them do so because they want to enhance their performance.
Right.
Some people want to go several rounds. Some people, and the thing about guys and boys is that when you sit together with them, people extol themselves, extol their virtues. They'll tell you they go 5 rounds, 6 rounds. Meanwhile, only one. And if you're not careful, you may want to be like somebody. And the point that as a urologist I always say, if you could give your partner one quality round, they'll forever be thankful. So you don't need to try to impress or try to
Peer pressure.
No, not at all. No. And that is why some of these herbal medications and alcohol, do come in. One of the things that the downside to their intake, you look at the vital organs, the kidneys,
Yes.
the liver, they can be damaged. And then there's a condition called priapism. Priapism is when your penis stands on end, very painful, and if the blood which is trapped in the organ is not let out within 4 hours, that penis is as good as dead.
Oh, no.
Yes, and that is what some of these, and we have a lot of them presenting to us. Apart from that, alcohol intake in general, you see, it may boost your confidence. And see, in the past, when you want to talk to a beautiful girl, you take something small to boost your confidence. But it affects your nerves, affects your brain. I mean, it dulls it. In the long run, you may even become depressed if you take it chronically.
Right.
It affects even your testosterone level. It can drop it. So all these 3 systems, the nerves, blood vessels, your hormones, can be affected by, alcohol. So those who take it just to boost their performance, in the long run, I always say, your lady will be there looking very beautiful, very attractive, but somebody will end up coming for her.
Oh, no.
Yeah.
Guys, we don't want that to happen, so please, let's listen to what Doctor is saying. Doc, thank you so much for all of this insight, and I'm glad that you mentioned, some of the supplements that come in to help. And so I would move to you, Nana.
Yeah.
Let's talk about ManUp.
Yeah.
The ManUp product, tell us about it and, what it's made up of and how it's helping. You know a lot about this product, so I'll leave that to you to just tell us about it.
Yeah. First of all, I would want to say thank you. Now, I feel very humbled being among 2 honorable doctors. The more reason why we would still want to pursue education to settle at being there, then we can equally, I really appreciate everything that doctor has said. So, and I agree with the lifestyle. Too much of everything they say is very bad. So you having to drinking, having to smoking, it affects your brain, and then all these things go down to affect you as a man.
Yeah.
When it comes to ManUp, the name speaks for itself. So you have to ManUp.
Right.
You have to be able to satisfy your woman irrespective of the time frame. Premature ejaculation is relative. What could be short to you might belong for you.
Right.
So when we look at ManUp, it has the Tonga Ali, anyhow you'd want to pronounce it.
Okay.
It has as far as maca, it has ginseng. All of these formulations, you realize that it has a way of improving upon your testosterone level.
Okay.
It goes a long way to even correct premature ejaculation with time.
Okay.
So when you are consistent in the intake of it, you realize that it would help you. You feel very confident in yourself. And
Right.
because performance anxiety, maybe you were very good, but for a reason or two, you came down. It would help to correct all of these things, and you gain your strength back as a man.
Right.
And aside that, the quality of your sperm, it plays a role with that.
Oh, wow.
Yes. So with time, anybody having fertility issue, with time, you realize that lately the doctors really write it a lot for their male clients. And then it's doing so well in the market. And so far, we need to thank ManUp for helping men manning up in their homes.
Wow.
There is one amazing thing when it comes to ManUp.
Okay.
Men also have challenges with their libido.
Okay.
Most of the times we think that it's only women who experience low libido. But there are so many men out there that if a woman is not careful, she might probably think that the man is cheating.
Oh, wow.
But just because the libido is
Down.
And men also encounter hormonal challenges. It looks like these things women think is just about them. So the reason why I personally settle with ManUp, because with time, the maca and the ginseng and some of these things in there would enhance your libido and then will give you the edge to wanting to be with your woman. For example, if you're wanting to achieve pregnancy and you're not being intimate with your woman, how do we get that?
Right.
So these and many other reasons why I personally would recommend ManUp to you as well. And to all the doctors who write ManUp, just so that they know their clients are coming in for them and then it is working better for them.
Wow. So that means there's an increasing demand for ManUp, from the point of view of the pharmacist and all of that, because of the benefits that men are getting from it, from premature ejaculation to libido, and even for the quality of sperm.
Exactly.
That's very interesting. I didn't realize that it had all of these qualities. Yeah. Wow.
And it's very simple to take. So mostly, preferably, because of its therapeutic effect, you are expected to take it in a run of a 24-hour.
Okay.
Either you split it into 2 every 12 hours. And one thing about our sphere is when you say one morning, one evening, anytime in the morning they take, anytime in the evening they take, it doesn't really help you achieve the greater potency of the supplement.
Okay.
But if your doctor should say take it twice in a day, they want you doing it every 12 hourly.
Okay.
Or you can do it one at a time, but then every 24 hours.
Okay. All right. So you've mentioned some ingredients in the ManUp supplement, and I'm glad to hear all of these names like the tonga, the maca root, the ginseng. These are all very organic and natural herbs that,
Exactly.
we know about. And I'm sure a lot of people will be also glad to hear that, because most people don't want to be taking in too much chemicals. So can you just go a bit into some of these ingredients and what exactly they do?
All right. So when we take the ginseng, for example, that is when it matters, even if you are not experiencing any of these challenges and you still want to be on it. It plays a role handling or managing your stress level.
Okay.
So we also take the maca, which helps with the libido.
Okay.
And then the tonga ali, they have funny ways of pronouncing it.
Right.
So we realize that even with just these 2 compositions, they are all playing role with your libido and then the blood circulation as well.
Right.
So when it comes to ManUp, I think it is underrated.
Right.
Yeah.
Wow.
And one more thing too is it's very organic. So its side effect is very minimal.
Right.
Minimal to zero at all. So as long as you are taking it as you have been instructed to, one challenge will be that, per maybe anxiety, you are being asked to take 1 twice, but then you probably feel, let me do 2 because I have this particular lady I want to handle.
Someone has a match, and so they are trying to over-impress.
Exactly. When you go about it that way, it would not help you.
Right.
But then when you take your time, within 4, 6, 12 weeks, you should know that it would help you.
Wow. Okay. So, from what you're saying, that means that ManUp is not only for, sexual enhancement when it comes to men. It has other benefits, isn't it? If you can just walk us through that.
Mainly the stress hormone.
Okay.
And psychologically, men think that we don't have to take medications. It's something that bothers the men a lot. Hardly would you find a man taking supplement. Anytime they are taking it, they probably think that they are feeling sick or they are feeling ill. But this particular one can even give you a very good sleep.
Okay.
Yes, I have a client that I served, and then now I don't want to say addicted to it, but he feels like, so all this while I was lacking sleep.
Right.
When he takes his evening session, he's able to have a very good sleep.
Wow.
Even if it's for a short period of time, he wakes up feeling that
refreshed,
exactly.
Wow.
So as long as you speak to your health provider, you are good to go. You can give it a try.
Okay, that's very interesting. So that means that ManUp has a very holistic, treatment effects, because it's not only addressing the sexual enhancement part, but it's also affecting your quality of life and improving it, improving your sleep and all of that. That's very interesting. And also handling things like stress. And, I like the fact that you mentioned that the ingredients are very organic and natural. And so you're not to worry too much about things like side effects that come from too much chemicals. Wow, you would agree with me that today's session has been very insightful. And I think that we should be having more and more of these conversations, because when it comes to men's health and all things concerning men, there's a lot of silence, there's a lot of expectations that men shouldn't complain, men shouldn't, have problems. They should be able to man it up and be strong. But these are some of the things that we need to learn about. And so I'm glad that we had this conversation. Thank you so much, Dr. Tobo, for your insight. Thank you, Nana, also for letting us know about ManUp and, some of these benefits that most of us didn't know about, especially me, and I'm sure most of my viewers as well. So remember, it's November, and November is all about men's health awareness. It's actually Men's Health Awareness Month. So let's continue to empower ourselves with knowledge, because they say knowledge is power, and be strong. And also be there and then be empathetic for the men in your lives, because we've learned a lot today about even the power that we as women hold in making sure that men are able to go out there and perform as we expect them to. So happy Men's Health Awareness Month, and see you in our next episode. Bye.
Bye.
Clock it.
Bye.